some of President Joe Biden's new vaccine requirements for federal workers, large employers, and healthcare workers. On September 9th, President Joe Biden announced a 6-point plan to increase vaccinations against COVID-19 and slow the spread of the Delta variant of the virus that has resulted in, literally thousands and thousands of COVID-19 cases and deaths. The most controversial part of the plan is the president's directive to the Labor Department to develop a temporary emergency rule for businesses with 100 or more employees that will require workers to be fully vaccinated or tested at least once a week. Republican governors have threatened to sue the administration to stop the implementation of the plan. Our panelists today are Dr. Michelle Taylor, who is the Shelby County Division Director for Health Services, and Albert Richardson, who is the co-founder and executive director of Cocaine Alcohol Awareness Program, and we call it CAAP. And he's also the chairman of, he's over the Tri-State, what is it, Albert?
Tri-State Community Health Center.
Tri-State Community. So you're the executive director of Tri-State Community. Okay.
Yes.
Okay, so these are our guests today. And we are going to start with, I guess what I'll do is I'll name the 6-point plan, which the president's plan, which is vaccinating the unvaccinated, further protecting the vaccinated, keeping schools safely open, increasing testing and required masking, protecting our economic recovery, and improving care for those with COVID-19. So I guess one of the questions that's constantly coming up, even with employers who have more than 100 employees, they don't have the rules yet. They don't know when to start and what specifically needs to be addressed and how to handle this. And so do they start now requiring the vaccinations, the weekly testing? How are companies supposed to move ahead with this without the details?
Okay. I'll let Dr. Taylor go first, and I'll follow her, Gale.
I'm fine with you going first.
Okay. Well, all right. Well, let me say, I think businesses have to take some responsibility. It's not about punishing our employees, but it is about protecting the environment in which they work. And so for CAAP, we initiated a couple of months ago that we do testing on a weekly basis for those who hadn't been vaccinated. Those who have received vaccinations, they do it every month. And so we try to make sure that we practicing social distance, the universal precautions is put in place, wearing your mask, washing your hands, sanitizing areas after people have left those areas or utilized those areas. It's extremely important. We have to understand that this variant is more contagious than the original strain. And so we have to put those preventive measures in place. Again, I reemphasize, it's not a punishment on the employee, but it's to protect them in the work environment.
Okay, so Dr. Taylor, so we know the health department has more than 100 employees. Are you following the directive, or have you been doing this before the president came up with this directive?
So we actually did start this before the directive. And I knew there was a reason why Albert went first, because he's exactly right. It really is about protecting the workplace. We've been going through this for 18 months, so we know people are tired. But I think everyone would agree with this latest surge with the Delta variant that it is even more important to start using mitigation efforts that we know work. And so even though employees may sometimes feel like it's a punishment, it really isn't. It's to protect them, and it's to protect their coworkers. So what we've done is we actually were asked by Mayor Harris to go first because we are the health department. And what we did was, of course, we consulted with our county attorney first. And you all will laugh, you know, physicians rely on attorneys more than you would realize. And it's because we understand the rules that govern personal identifiable information. And so you understand that before you ask any employee anything, especially about their health status or their vaccination status, you need to make sure it's kosher with all of the labor laws and what the attorneys say are allowable within your business. So let me say that first before I give any other advice. Normally, Marlene Iverson would be on a call like this with me saying the same thing. All right. So that's the first thing. Consult with your attorney.
She's the county
attorney. So consult with your attorney first within your business to make sure that anything that you're asking your employee is allowable. So what we found on the county side was we wanted to canvass our employees because we knew we were going to contract with the company to actually provide the frequent testing. But we needed to know what number we were dealing with before we did that. So we consulted with our attorney to say, okay, what can we ask about vaccination status? And I actually drove them crazy, making sure that we asked her first, because some of you all know I come from the military side. So even when the pandemic first kicked off, we couldn't ask military members what their vaccination status was at first. So
you said at first.
At first, because the military had to make sure it was legal as well. So I said, no, we need to know what we can ask and what we can't ask. So once they came back with that decision, it was, you can ask one question: are you vaccinated or not? So that was the only question we asked. Yes or no, or decide not to answer. Always give, the choice of I decline to answer. Okay. But remember. So
let me ask you this before you go on. So by asking, are you vaccinated or not, that is not a HIPAA violation.
For us, it was not a HIPAA violation. But once
again, you're saying for us, you mean government?
For government, it was not a HIPAA violation.
Okay, but I just need clarity because that's one of the issues that continue to come up, the HIPAA issue. So I just wanted to be clear, because when you talk to different attorneys, different companies, we are hearing different things.
Exactly. And that's why it's important to consult with your attorney so that you can get the correct advice for your level of business, employment, and all of those things. Remember, whenever you're kind of a health agency, one of the conditions of employment is to be vaccinated against certain diseases. So in our case, more than likely, it's not a HIPAA violation because of that. We have people, front-facing people to the public, that have to interact with the public. So just like they can't be giving the public tuberculosis, they're not supposed to be giving the public measles, all of these things that you would normally be vaccinated against, then you don't want to be giving the public COVID either. So it was not a HIPAA violation, but I will tell you that the reason why it was one question only, is because once you venture outside of that, then you can get into trouble. So you can't have your managers who may be asking this question saying, well, why aren't you vaccinated? Because that for some people, human nature is, if somebody said no, and they don't agree with the idea that they're not vaccinated, then they want to ask follow-up questions. We were very clear, there are to be no follow-up questions. There's one question: yes, no, or you decline to answer. Because we were just trying to figure out what numbers we were dealing with to begin with. Once we determined that, then we could go and talk to a couple of different businesses that do testing and find out what we wanted our strategy to be based on cost, what the budget would allow. And, once again, Dr. Randolph and I, being physicians, what we felt like would be the gold standard to make sure we knew the status of our employees that were choosing not to be vaccinated and would be required to test weekly. So there are a number of different types of tests that you can do. You could have everybody test individually. You could do by a PCR test, which is the gold standard. You could do a pooled PCR testing. And what that is for those of you who don't know, you have a group of people, a pod per se. So say you divided your employees into groups of 15, and you have samples taken from all 15 of those people. It goes into a pool test. And then that pool of tests is tested for COVID. If it comes back negative, it means that everybody in that 15-person pool is negative. But if it comes back positive, at that point, the testing company tests each individual sample, because they will have put a portion of the sample to the side to see which one of those individuals was positive. And then they can determine who was actually positive within the pool. But what's nice about pool testing is if you have 10 different pools of 15 people each and they all come back negative, then great. Everybody's negative, you're doing great, and you go on to the next week before you have to test again. But if somebody is positive, you determine who that positive is, you determine who their close contacts are, you isolate the positive, early identification, and you quarantine the close contacts, and you keep the workplace safe. So really, testing is about making sure that you have early identification if possible, so that you can keep the workplace safe. So like Albert said, it is not about punishing employees. It really is about keeping people safe. And the other thing from the call we just came off of, the other thing is you're hoping that by doing a weekly test, you eventually convince those people who are still on the fence about getting vaccinated that they're tired of getting a weekly test, and that they'll go on and get vaccinated so that they don't have to undergo that process. But it really is about determining your strategy and deciding based on cost, number of employees, all of that, what you think your strategy should be. Now, of course, like you said, the president's plan is very broad right now. We know the categories, we know the law that they're going to use, but we don't know the specifics. And so, of course, we'll have to wait for those specifics to know, okay, based on the rules that they're giving us from OSHA, what can our strategy be? But I will tell you for now, the county, what we've done at the Shelby County Health Department, and I know Mayor Harris is looking to do it in other divisions, is we are having a weekly strategy of testing for those employees that we know are not vaccinated. The other point I'll make, and then I'll turn it back over to you, is for the vendor that we used, we have an option where the employee can check that we can have the results in addition to them getting the results. That makes it a little bit easier, because if they do opt to do that, then you're not chasing around an employee trying to find out what their results are. Of course, they have to opt to do that. That's voluntary. But just keep that in mind when you're coming up with your plan. If you have a lot of employees that you're thinking are not going to opt to do that, you need to have something in place, somebody within your organization who's going to be able to track that information and track employees down who may not be as easy to find out what the results are. And just make sure, really, you need somebody in place, because there's a heavy administrative lift with this, with the tracking and making sure you know what the results are. I'm assuming that most of your organizations have some person who's responsible for OSHA level requirements. You may want to engage that person now to make sure that you're starting to think through what your plan may be based on the number of employees you have. And also remember that as private businesses, you can set the conditions of employment. So if you
and that's key right there. That's key right there.
So if you know that you're going to set something as a condition of employment, Have that in place for all your new employees coming in, and be prepared to change your policy to make sure you're setting that as a condition of employment. All these things I'm telling you are based on our experience trying to get this off the ground. We did it the week of September 6th. We're about 3 weeks in now, 4 weeks in, and we've had to make a few tweaks along the way. And we do understand the administrative lift, associated with figuring out, okay, we have this number of employees who we know we need to test weekly. And then, you've got some who are going to come in and say, oh, I got my first shot, but haven't got my second shot yet. What are the rules around that? What are you going to do if somebody doesn't test every week like they're supposed to? What are going to be the consequences of that? So those are some of the things that you need to be thinking through ahead of time as you get ready to craft your plan.
Okay, so you have mentioned a number of things that of course I got a yellow bulb flashing. So you mentioned OSHA. So does OSHA only have control or directives for companies with more than 100 employees? So you mentioned OSHA a number of times.
Right.
So
well,
what is
that's
the
because
role with OSHA and all
you're
of this?
looking at, I've got the document pulled up, that same one with the plan. And it basically says that for now, what the White House is looking to do is requiring all employers with 100 plus employees to ensure their workers are vaccinated or tested weekly. And then it goes into their Occupational Safety and Health Administration and the rule around 100 plus employees. But here's the kicker. Even those companies, the next paragraph talks about for all federal workers and for millions of contractors that do business with the federal government. And then that's where you start to think about, okay, there are some people who do business with the federal government that have less than 100 employees. So then what are they going to use to put that in place as well? So you got to think about all of that. But I know for the 100 plus employees, they're really looking at the OSHA laws around that.
Oh, that doesn't govern companies that have less than 100 employees?
Great question. I would have to find out that one for you. It probably depends on what kind of company it is.
Okay, so let me ask you this. What percentage of Shelby County employees, not Shelby County, but Shelby County employees are vaccinated?
You know what? Shelby County government or Shelby County Health Department?
Shelby County government. You can also, what is it for the health department? What percentage of the health department employees?
I'd have to go to my people to see what the percentage is now, because I do know that some of our folks have decided to go on and get vaccinated based on what we've been doing for the last couple of weeks. But when we started the program, I'd say around 65-70% were vaccinated based on, and this is just the group that we know aren't on the FMLA, weren't on LEAP, all of those things when we first collected the data. So the data is not perfect. And so as a, epidemiologist, it's hard for me to say that number without giving you all those caveats. On the Shelby County government side, I have heard that it's as high as 70%.
Are you serious? Really?
That's what I've heard.
That's
now, I cannot verify that number because I did not collect the data. Here's my caveat again, but I have heard that. And the other thing to remember is, and this is what I reminded my counterparts of when we were asked to be the first division to go. There were people who thought we would have a very high percentage of people who are vaccinated because we're the Shelby County Health Department. And I had to explain to folks, listen, Shelby County Health Department is not unlike any other place of business in the county. It is a microcosm of the county. And if I know right now in the county, there are about 50% of the county who's had at least one dose, then my guess before we started counting was that about 50% of my health department was going to be vaccinated. And people were like, I had some people who were like, that couldn't be so. These are professionals. Yes. But these are professionals that work at the health department across a variety of socioeconomic statuses, across a variety of circumstances in their life, across a variety of beliefs, cultural and otherwise. And so why wouldn't our workforce reflect what the county reflects? So that was my thing of reminding them from a data standpoint and from a population health standpoint that we can't be so quick to say, well, our employees are just going to be better than the regular. No, they're going to be the same as the general population that you're sitting in, unless you're talking about a select group of people who have more than one degree, who have one belief system. There, you would have to have a more narrow group to be able to make a generalization of what you would think. And I think most people would agree with COVID, all of that has been blown out of the water. You can make no assumptions about somebody's vaccination status.
I know that's right.
You just can't. I don't care if they're college educated. They may not be vaccinated. I don't care if they have 6 degrees. They may not be vaccinated. You cannot assume anybody's vaccination status. And if you do, you're going to get your feelings hurt.
And that happened to me this morning. I found out about somebody that's been close to me for years, got a master's degree, and she's 100 years old like me, and she's not vaccinated. Albert, what percentage of employees at your place are vaccinated?
And we'll probably say that average too is 65 to 70%. Even on our primary health side, we're seeing even practitioners who are not getting vaccinated for one reason or another. So we see that same thing. About 65, 70% are vaccinated. The other 30, 35% is not.
So Albert and Dr. Taylor, I'm just speaking for myself and probably many others who feel like I do. When we hear about employees who work in the healthcare profession not being vaccinated, that's not a good sign. That's not a good message that's being sent to people who are not vaccinated. It's not a good sign. Is it that they don't trust the medicine? They don't trust the data? They don't trust the science? What is it? I mean, it's kind of disturbing.
Well,
we saw people in the healthcare industry out on the streets with signs protesting.
That's right. And Gale, it's funny you say that. When we talk to, specifically, I got 2 sons at MSU, and I talk to them constantly. I'm in this field and talk about the impact, and they know family members who have been impacted by COVID-19, and yet I still struggle to get them to understand the importance of getting vaccinated. I asked a question, and it's an important question to ask because I have heard all kinds of reasoning behind not taking the vaccine. It hadn't been approved. We go back.
Now. It's approved now.
Yeah, we go, but that was some of the excuses. We go back to Tuskegee. We talk about.
They don't even know about Tuskegee. They don't even know the truth.
But those are the things that we hear. We don't. It's something in it we don't know about. It's a way of tracking you. I have heard all kinds of ideals and
Albert,
ideologies about this.
And I have to really interrupt you right here because about the Tuskegee stuff, I believe that you have to give people correct information.
I agree.
The Tuskegee study was not that Black men were given a disease. They were not. They were given, they were not given medicine.
Exactly.
They were not given something that made them sick. That is not what happened.
That's right.
You got people out there spreading it like they gave these Black men something and they got syphilis.
Right.
They already had syphilis.
Right. And even though, Gale, you educate people on the facts, it doesn't change the theory that's embedded in their minds. And so, I asked my sons this question. I asked them simply, how many people have died from COVID-19? They said, Dad, it's been hundreds of folks who, I said, hundreds? They said, well, thousands. I said, thousands? I said, more like closer to over 500,000 people, 600,000 who have died plus. I said, now that's just counting the ones who have died. We're not talking about the ones who have been affected, right? Exactly. So I said, you understand that fact, right? That's a fact. You can read it. You can find it on anything. You can go on internet. You're crazy about going on your on Facebook and the other things that social media that you look at, and you can find these facts. But how many people have you heard die from the vaccine? No. And it just, I mean, they just got quiet, mouth dropped, because that's a reality. You know, if we look at the facts, our community is being torn up. People are dying all around us every single day. Yeah. Our children.
That's what's amazing. Yeah. Every day I'm hearing about people I know dying.
And you know, our children are being placed in situations that are harmful and dangerous. Yet we argue about the logic of wearing a mask. You know, we have made this a political football, and people dying every day. You know, and they're dying from every area, every economic, every social economic environment. It doesn't matter. You're being impacted by it, and you know, we have to take serious the impact that it has on our community as well as our economic situation. You know, we talk about people not working, people who can't leave their children at home alone, so they don't work. We talk about our children who we send out in our community every single day, and we don't know what's going to happen. You know, we don't know if their friend, if their neighbor, if one of our family members has, because we got family members sit around the table every day and refuse to take this test. So, you know, it's important for us to stress and educate the seriousness of this virus. You know, kids seem to think they're bulletproof. And the fact is, that's not so. You know, we'll send more children in hospitals than we ever have before with COVID-19 and in critical care.
You know, Albert, last year, before we got the Delta variant and before we got the vaccine, young people considered it an old person's virus because they were not getting hit like they're getting hit now.
That's
Children were not dying like they're dying now. But I do have two questions in the chat and that I want to ask, because we ask people to submit questions. So one of the questions is, would weekly testing become costly? And what funding would support the testing? And would this come from the company or federal funding?
So for right now, we believe that businesses will be required to fund the tests themselves. But who knows? This is one of those specific details that we just don't have right now. Now, in the document that I can see from the White House, they are saying that there's a chance that they will subsidize time off from work if you have some side effects from getting the vaccination. Mm-hmm. But they haven't said, from what I've read, anything about subsidizing the cost of weekly testing. But that may be why we don't have specific details right now, because you may have people who are lobbying to make sure that that occurs, given that this would be a pretty sweeping law. And if you would admit that it could become quite costly for some smaller businesses that are right at 100 employees, or even smaller, but are contractors with the federal government. So hopefully they will have those specific details as they roll out this plan.
So Albert, how are you all handling the cost for your weekly tests and vaccinations?
Really, we've been blessed on that end. With Tri-State Community Health Center is a FQHC, and I'm sure Dr. Taylor is familiar with Tri-State. One of the things, we get reimbursed on the state side, plus we get federal dollars to provide the vaccinations as well as the testing. So for our employees on the CAAP side, on our behavioral health side, they get testing at no cost. And anyone who comes to us will receive that testing at no cost, and the vaccination is no cost.
Okay, and so the another question is, are there any exceptions from the mandate, i.e. religion, health, conditions, etc.? Are there any exceptions for these mandates?
I'm sure that they may throw in some exceptions for certain medical conditions, but I can speak to that on the military side. Very few exceptions on the military side, but of course the military was able to mandate vaccinations. They didn't even say you're going to have a weekly test. They said, no, you're going to get this shot or you're going to have to get out. You know, but the military can do that. So I'm sure that when they bring out the specific details, they will also have those exceptions. But I would say that those exceptions are probably going to be a short list. And they will also remind businesses that they can do things that become conditions of employment. So that's the other thing. When you have that clause in there, you know, you can do that as a condition of employment. And that's why you've seen some businesses, after they've consulted with their attorney, go on and plow ahead with mandatory vaccinations or mandatory testing because they know they can make that a condition of employment.
Well, and with St. Jude, they were supposed to make at the end of September mandatory that their employees be vaccinated. I can't remember about the testing part, but Emory in Atlanta, they require that their employees be vaccinated or that they be tested weekly. Now, and you mentioned also, as we talked about the cost, if any of the costs, if the companies decide not to incur the cost, then the employee has to cover those costs weekly, or will their insurance companies cover those costs weekly?
Well, that's a great question. And it will depend on, I will tell you, it will more than likely depend on the insurance company. Because some insurance companies will say, no, if you're not having symptoms, we're not paying for a weekly test because you should already be vaccinated. So the insurance companies can set their rules too. And I will tell you that, you know, most insurance companies that I have experience with, I don't know, and Albert may be able to speak to this more than me because he's on the FQHC side, but most insurance companies are not going to pay for what they deem as an unnecessary test, meaning that you're just getting tested as a screening test when there's an available vaccine to prevent you from getting the disease and you're not having any symptoms.
Right, and I would agree with you, Dr. Teller. That's going to be that case, that they're going to see medical necessity as an issue with mandatory testing.
Well, you know, I'm going to say this before I ask you to do some closing remarks. I have listened to so many people talk about they don't know what's in the vaccine, but they also don't know what's in all these other medications and over-the-counter drugs and prescription drugs that they're taking. And I hate to use this as an example. Somebody mentioned to me today, some people who smoke marijuana, which I ain't condoning it, they're saying that they're being laced with, what's it, Ferdinand or some kind of stuff that they're being, they're taking all that kind of stuff that can kill them, but they won't get vaccinated because they're saying they don't know what's in it. So, I mean, I have listened to so many people talk about they don't know what is in the vaccine, and that is why they won't get vaccinated.
You know, yeah, and I'll just throw this in, and I heard that too. But, you know, it's funny, you know, we have to take vaccinations to go to school. Our children do. You can't go to public schools unless you have these set of shots and prove that you had those set of shots. When I go to the doctor, sometimes I have a sinus infection. I get the cocktail shot. I have never asked my doctor what's in it. I just wanted it to work. You know, at bottom line, I just wanted it to work. And I think we need to really, you know, get our heads wrapped around the fact that this is not going away. And if we don't get serious about it, it's going to get worse because, you know, it can mutate into something else. And that continues to happen until we get a certain segment of the population vaccinated. You know, we get what we call herd immunity. And we're not there yet. And we're not going to get there if we keep arguing about, you know, or making this a political issue when it's not. It's a life and death issue.
Albert, you're saying it's a political issue, and a lot of people are saying it's a political issue,
Yeah.
but it's not a political
No, it's
issue
not.
for a lot of folks, especially Black people. It's not a political issue
No.
for them. Well, I'm not going to say what I think it is, but anyway, it's not. It is political for many people in this country. For many people, it's just not. They just are not getting the shots, right, Dr. Taylor?
Well, I would push back a little bit on that. It's a political issue in a different way for Black people, because in a lot of instances, they're making it into a social justice issue. But what they don't understand is that it's a social justice issue that has been tainted by a propaganda message.
That's right.
On the political.
Okay, well, I'm glad you cleared that up, because I've been looking at it as an extreme political situation, but from a social justice.
It's bigger than that.
It's bigger than that. So, when it was made into a political issue, it allowed people who spread misinformation to exploit the social justice issues that African American people and Native people, particularly in this country, and the Latinx community, have experienced historically in the country. So those issues have been exploited to keep people from getting vaccinated from the COVID vaccine. So
now y'all shared that with me. I mean, that's some new information I have learned. I try to learn something every day.
They've exploited it, and they've used human behavior. So especially with the Delta variant, and it's mixed with what we already know from science, that how viruses act. COVID-19 doesn't act any different from any other virus. The difference is that now we have a virus that's been allowed to run rampant through the community, and it has mutated and gone viral. That's where that term comes from on the internet. It has mutated because it has been allowed to run rampant through multiple, what we would call hosts, and change in such a way that it gets around the normal body defenses. And so what you have is now areas of the country that have vaccination rates north of 80%, guess what? They're partying, they're going on with their lives, they're doing great. They don't have what we have going on down here. And it's simply because those people decided, you know what, I'm gonna go get this shot because it works. And I don't need to know what's in it, because guess what? When I went to get my vaccinations, or I took my kids, and see, I'm a pediatrician, so I know this to be fact. We give a packet of leaflets for every vaccine that we give a kid. It's usually 2 pages. It is very small writing with 4 columns on both sides of the paper. And I could probably count on one finger how many times I've seen a parent read that. But it tells you what's in it. So now you have a group of people who have decided to say, well, I don't know what's in it. You don't know what was in that MMR you got in 1982. You don't know what's in that chickenpox shot that you got in 1995. But now you want to say you don't know what's in it, but you don't know what was in that hookah that you smoked at the club last night.
Oh, exactly.
So this is what I say to especially young people who come at me with that. And then I say this time around for this surge, it's not only a surge of the unvaccinated, it is a surge of people less than 45 years old. And they're not just sick, they're dying. And they don't just have underlying conditions, which shouldn't be a reason why you would have to die. They are dying. These are perfectly healthy people that the only thing that's wrong with them is that they didn't get vaccinated and they got COVID-19. And that thing is shutting down their organs and killing them.
And that's a commercial right there, Dr. Taylor.
Mm-hmm.
And I'm going to ask you all one more thing before we close out. And that is about this third shot and the booster. On Tuesday, September 7th, a day after Labor Day, I got my third shot. And I've explained to people it's not the booster, but now I'm hearing on the news that people shouldn't be getting this third shot unless they fall in certain categories. And maybe I fall in those categories, but I did give them my card to show that I had had 2 Moderna shots. And they gave me my third shot. Another young man who was 41 years old, he drove through there, showed him his card, and they also gave him his third shot. But now people are saying we shouldn't be getting them. So what is the? That's what I'm saying. It's more mixed information out here. And should I have gotten the shot?
So
because the day I went, the young man who gave me the shot, I said, "Y'all been busy." He said, "Not today." He said, "But Friday we had more than 600 people here getting the third shot."
So the additional dose is approved for people with immunocompromised conditions. And I'm not going to get into your whole health picture, but it is approved for people with immunocompromised conditions. And I will tell you that the original plan was to do booster shots, people with normal immune systems, a third dose for the general population, but it still had to be approved by the FDA and a committee called the Advisory Committee on Immunization Practices, ACIP. ACIP met today to decide what the recommendation, like they're probably still voting now because it has gotten pretty contentious. So what we know is they're voting on 3 questions. So I actually got a chance to be on a state call before I took this call and the call before this one. They're voting on 3 questions. Today, they're voting on whether third doses should be given to 65 plus and people living in long-term care facilities. Most people believe that that's not the contentious question. They're going to vote yes on that, and the FDA is going to approve it. Okay. But the 2 questions that are contentious right now with this committee and the people who do the research, they want to know if they're going to vote on 18 to 64-year-olds at risk for severe illness due to underlying conditions. And really, they would normally vote yes on that, but they're arguing about what the underlying conditions are. So is it going to be a specific list, or is it going to be more broad, like you're obese, you have hypertension, those kinds of things? So they've got to argue about that. That's why I said they're probably still arguing right now. And then the other question that they're voting on today is, and it may be in the news right now, so I'm just telling you what I heard earlier, 18 to 64-year-old at risk due to their occupation, where they work, or the setting that they have to be in for the majority of the day. So that gets to people in colleges and universities, people who are working in crowded conditions, warehouses, things of that nature. Okay.
What about obesity?
So that was the question before that I said, the first one that's contentious. 18 to 64 at risk for serious illness due to underlying conditions. Obesity is considered to be something that will put you at risk for an underlying condition, because if you're obese, you may have pre-diabetes, you may have diabetes, you may have heart disease that hasn't been identified yet. You could have all of these things. So the committee is trying to decide, hey, we want to give this third dose, but who should we recommend get it? They know that 65 plus and people in long-term care facilities should definitely get it. Like, I think that that's going to come out. That's going to be the recommendation. If we don't get any other recommendations tomorrow, we'll get that. And then we'll have lines of 65 plus year olds in line, right?
I'm not 65.
And you don't look it. You don't look it. So there's that. But like I said, those other 2 questions that will get at younger age groups, but age groups that may be at risk, those are the ones that they have to decide. And I see somebody putting it in the chat, so they may have released it, which means I'm going to have a pretty long day tomorrow because we're going to have to figure this thing out. But those are the ones that they have to decide who is going to be who is going to be in that group that should be getting third doses right now. I do believe that eventually they'll open it up for the general public, but they're not ready to do it yet. They're just not ready because, you know, remember, these scientists are looking at the numbers across the country. They see what's going on in the southeastern states. They want to try to do something to help. And so what they're doing is seeing, okay, what are the priority groups that we really need to be targeting so that we can save more lives? Because at the end of the day, that's what this is about. We're trying to save more lives. So if I have to engage in conversations at a restaurant, in a grocery store, at the gas station, in the parking lot of the library, I've had people just across all walks of life stop me and ask, well, should I? Or how do I tell my son to get it? All of those things. It's those one-on-one conversations at this point that's going to help us move the needle, because we already know as a group, 20-somethings, 30-somethings feel like they're invincible because they haven't done a lot of living yet. And so when they haven't done a lot of living, it's normal human behavior that they think they're invincible and they're not going to die from anything, even a deadly disease that they know has killed 600,000 people. They just don't believe it can happen to them. And our messaging has to get across the fact that, hey, yes, we would hope that you get to live to a ripe old age, but tomorrow is not promised to anybody, especially when we have a deadly virus running around the community.
So, Dr. Taylor, it's interesting that you say some of these young people think that they won't die, and you're absolutely right. But there's a segment of our population, a segment of our race of young Black men who think they're not going to even live to be 30 just because of the way that they live. But they still won't get vaccinated. So, but anyway,
well, I can't let you leave it there. The reason, and that's the other reason, right? Mm-hmm. So why do I care if I survive if I don't think anybody else cares if I survive?
That's right.
Yeah.
So that's the other piece, is getting over to them. There are people who care if you're here, and you should be doing everything possible to be here because you can contribute to this society, to this community, and you already do by your presence. We just have to make you believe it. Mm-hmm. So that's,
but on the call that you were just on, was it Doug Brown with the Peabody? He mentioned about having celebrities and different people do promotional stuff to try to encourage these young people to get vaccinated. But some of them probably are not vaccinated themselves. But I mean, there is enough of them that we probably should, focus on that. But in order to touch some people in some neighborhoods, you're going to have to use people who live around those people that they look up to, people they listen to, who they believe. So some people don't just listen to everybody because they're celebrities. You got to focus on who do these people listen to, and try to get those people to talk to all of these young people. And we talk about young people because there's a lot of them just not doing it. But there are a lot of older people not taking the shot either. Like I mentioned earlier about someone I've been knowing since I was 12, and we both are 100 years old, and she got a master's degree and she doesn't have a shot, and she's at the doctor's office today. So I don't know if she's okay or not, but we all were shocked that she wasn't vaccinated. So it's going from all ages. The new thing is we got all of these young people who are now dying as opposed to just being sick. So another question that we have is there data that Delta is now mutating?
So we know that there are other variants out there. It's not necessarily that Delta is mutated. It's just that the virus is mutated, period. So we know that there is a mu variant that's out there that the World Health Organization is looking at. And so we are on the lookout within Shelby County as they sequence different variants. And most of the virus in Shelby County right now is Delta. But we're always on the lookout to see if we have any cases of mu or anything else that's come on the scene.
And I would add to that too, Dr. Taylor, that the vaccine that we have in place that we're using now,
yes,
is effective against the variants. Mm-hmm. So people need to know that and be aware of that.
Okay, so we have a few minutes left. So Albert, we'll start with you. What recommendations do you have, suggestions that you have for our listeners and our viewers today?
Okay. Well, first of all, I'd like to say, Gail, thank you for this forum. Thanks, Dr. Taylor, for all the information that you brought here today. I think my recommendation now is to really get out where the people are and educate those people where they are. And that means our young people, you know, they don't go to the same places that older people go to.
Right.
And we need to get to the places where they go to. And we need to send people who are their peers that they can talk to the same lingo that they talk and get this point across. You talked about a lot of the rappers, for example, hadn't taken the vaccine. But those who have, let's get them out there talking about it. You know, you hear people talk about the negative part. You know, they said, you know, an empty wagon make a lot of noise. You know, let's make the wagons that got something in it make some noise. You know, go get on social media, talk about, you know, your experience. You know, people talk about, I got sick with, or people get sick when they get the vaccination or the first shot. You know, what I had was a sore arm for about a day, and that's it. And so, you know, we need to educate people where they are. I think that's the most important thing. And I think, you know, you talk about that population that has no hope at this point, or act as though they have no hope. But we got hope for them. And we need to express that. I think, Dr. Taylor, you put it best, that we need to let them know their worth, you know, that we believe that they have worth and get where they are. And so that would be my heartfelt opinion on how we should get into those streets, get where the people are, and get them the information they need. Because people die for the lack of information.
Okay, so Albert, could you give us information on where people can go to your locations to get vaccinations and or tests?
Okay, we have 2 locations that you can either get the vaccination or you can get tests at either one. The first location is the main location. That's Tri-State Community Health Center at 4041 Night Arnold Road. The clinic is open 5 days a week, Monday through Friday. You can call and they'll make arrangements for you. The health department also has a list of all the FQACs and other places that are giving shots and tests. And I'm sure Dr. Teller referenced that in our communication as well. And then we have a Lamar location, 3839 Lamar Avenue, that we do testing Monday through Friday, as well as vaccinations. You can go there. It doesn't cost you anything. You know, you can drive right up, you know, they'll get your information, or you can make an appointment. And so again, you know, we welcome you. If you have any questions or need additional information, please call us at 360-0442.
Okay, thank you, Albert. And one of the things that you said that sparked something about it being free. Everything is not perfect in America, but I think we're doing this right. We're making this vaccine and this testing free for everybody. There are countries that do not have the vaccine, and that there are countries that are charging for testing. So, right. Dr. Taylor, we'll move to you.
So I put in the chat all the link to all the testing sites in the community, commercial and free mass. And then the other thing to know is that we are currently in the final planning stages of opening the Whitehaven pod again. We'll have a soft opening next weekend. And we will be giving COVID vaccinations, Pfizer, on Fridays and Saturdays for several Fridays and Saturdays leading into November. So that's one thing to know, that is coming in the Whitehaven area. And then I think Germantown is about to open their pod again as well around the same time. But the main message that I want to get out today is that if you know you have already been vaccinated, start finding the people in your family and in your community who you know are not vaccinated and start talking to them. If you are part of a faith organization, you go to a church or a temple, a synagogue, a mosque, any place in the community where you know people gather, because we know some churches are gathering now and some places of worship are gathering. and you know you have a segment of your congregation that is not vaccinated, you need to find your trusted leaders who are vaccinated and start talking about vaccination as much as possible and putting those mitigation efforts in place wherever you gather. And then as an individual and a community member, lead by example within your businesses and within your community. You have a lot of latitude in your business to say what has to happen in your workplace. You don't need the Shelby County Health Department to come and say what has to happen. You can do that on your own as a business and as a community leader and as a community partner. We cannot do this ourselves. We cannot vaccinate. Shelby County Health Department cannot vaccinate everybody. I wish we could, but we can't. We depend on community partners like Albert's locations, FQHCs, like the other FQHCs in the community, the hospital system, the retailers. We depend on all of these people to do everything possible to vaccinate people, to encourage testing for early identification, isolation, and quarantine. We depend on the schools to partner with us to make sure that they are isolating the children who are positive, that they're isolating their staff that is positive, that they are following the mask requirements. We depend on law enforcement to help us enforce the things that we do have in place. And all of these things are not for punishment. A lot of people feel that way, but it just simply is not. It really is for the common good. And we really are trying to save lives. And all of these people that I mentioned have been instrumental in saving lives just over the past couple of months. You see our numbers coming down. The mitigation efforts are working. They are working, but we still have a lot of work to do. We still don't have enough people vaccinated in our community. We still have the threat of other variants coming in and causing another surge. And so we have to continue to keep that message up to save even more lives. I'm tired of seeing on my social media feed people younger than me, I'm 45, people younger than me dying. And I know they didn't have to die. I know they didn't have to die. They are dying preventable deaths. This is different than at the beginning of the pandemic when we didn't have a vaccine. This is different. This is real. This is people dying preventable deaths. And I will tell you as a physician, that's one of the hardest things to see. That's why you see your healthcare professionals looking so upset and beat down, because one, they're seeing people die preventable deaths in the hospital. And two, they're seeing people die preventable deaths from other conditions because they don't have enough room in the hospital to take care of everybody they need to take care of. So get those gatekeepers in the community that you know are vaccinated and mobilize them. If there's anything you want me to come in, if you think it'll help for me to come and talk, get in touch with me. Gale knows how to get in touch with me. I will come wherever you ask me to come. If my schedule allows it, I will do it. And I will tell you, my schedule is just booked solid because I'm trying to get the message out. We at the Shelby County Health Department are trying to get the message out as much as possible. As these numbers come down, I feel like this is the most important time to get as many people vaccinated as humanly possible so that we can save even more lives.
I just can't thank both of you enough for the information that you have shared, because much of this is about making sure our community has not just information, but the proper, correct information. And I greatly appreciate you both. So our guests today were Dr. Michelle Taylor, who is the Shelby County Division Director for Health Services, and Albert Richardson, who is the co-founder and executive director of CAAP, which is Cocaine Alcohol Awareness Program. And he's also the CEO of the Tri-State Community Health Center in Memphis. I want to thank our guests today for being with us for Memphis Like Gas and Water's Power Pivot webinar. Thank you, everyone, for watching.
Thank you.
All right.